Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
WBC in urine. WBC can be present in urine, especially if there is increased neutrophil count. If you see that there is increased neutrophil count is found in urine, then always increased neutrophil count in urine will signify that there is infection. Then, if number of our WBCs in an uncentrifuged midstream urine sample in a woman if the number of WBCs in an uncentrifuged urine sample in a woman are more than 10 per ml, then it is abnormal. If they are WBCs, or if you found out to be more than is around 3 to 10 per ml, then actually it is doubtful significance if the WBC numbers are between 3 to 10 per ml. If the WBCs are less than 3, obviously they are not significant. This is for a female. Then the same if you do it for a male, that is if the number of WBCs in uncentrifuged midstream urine sample is found to be midstream urine sample in a male is found to be more than 10 5, more than 5. If the WBCs in the male, not 5, it is more than 3, sorry. Yeah, if the number of WBCs in uncentrifuged midstream urine sample in male is found to be more than 3 per ml, then most of the cases it is abnormal. Then if the number of WBCs in the centrifuged urine sample in the centrifuged urine sample in the centrifuged midstream urine sample, if the number of WBCs in the centrifuged midstream urine sample in both males and females, if it is more than 5 WBCs per high power field, then it is abnormal. Then sometimes eosinophils can be present in urine. So what is the condition where eosinophils are present in urine? Eosinophils are present in allergic interstitial nephritis. Eosinophils are common in urine. Then we have Waite and Hansel's stain. Waite and Hansel's stain will detect eosinophils in the urine. Eosinophils in the urine are detected by Waite and Hansel's stains.
thank you and thank you for watching.